Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Finance. Consideration of these estimates left on Resolution 7.5. At this point, we will allow virtual members to unmute their mics so they can respond to the question I will now call. Resolution 7.5. Resolved that there be granted to Her Majesty a sum not exceeding $23,230,000 for finance, compliance, and enforcement for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Oh, we can't hear anything from Zoom. Pass. 1 second. We didn't hear that. Can you just repeat the question, please? No?
Shall the resolution pass? The resolution is accordingly passed. Resolution 7.6. Resolved that there be granted to Her Majesty a sum not exceeding $23,607,000 for finance, consumer protection. Oh, sorry. $23,607,000 for finance, consumer protection, and business services for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 7.7. Resolved that there be granted to Her Majesty a sum not exceeding $9,046,000 for Finance, Treasury Board Secretariat for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 7.8. Resolved that there be granted to Her Majesty a sum not exceeding $2,222,000 for Finance, Priorities, and Planning Committee of Cabinet Secretariat for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 7.9. Resolved that there be granted to Her Majesty a sum not exceeding $2,591,000 for Finance, Intergovernmental Affairs for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 7.10. Resolved that there be granted to Her Majesty a sum not exceeding $125,000 for Finance, Capital Assets for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. The last item to be considered for these estimates is item 7.1A. The minister's salary contained in resolution item 1A, the minister's salary contained in resolution 7.1. Shall the resolution pass? Oh, sorry. The floor is now open for questions. Seeing no questions, shall the resolution pass?
Pass.
Oh, sorry.
Pass.
Okay, I'll have to read this. Resolution 7.1. Resolved that there be granted to Her Majesty a sum not exceeding $7,154,000 for Finance, Administration, and Finance for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The
Pass.
resolution is accordingly passed.
That was on the mic there.
This completes the estimates for the Department of Finance.
Turn your mic off for a second.
The next department to be in this committee is the Department of Health and Seniors Care. Does the minister need a couple minutes? Do we need to recess for a couple minutes before the minister is ready, or is the minister ready to go?
We're ready to begin, Mr. Chair.
Okay. So you know you need to come to order.
This section of the Committee of Supply will now resume consideration of the estimates for the Department of Health and Seniors. As previously agreed, questioning for this department will proceed in a global manner. The floor is now open for questions. The member for Union Station. Member for Union Station.
Thank you very much, Mr. Chair. I'd like to start by asking the minister if she can provide an exact number in regards to how many healthcare workers, and that would be nurses, healthcare aides, et cetera, are currently vaccinated. And if the minister doesn't have that number immediately available to her, would she be willing to take it as an undertaking? Thank you.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair. I would like to ask the honorable member for Union Station for some clarity on the question posed. So for some definition as to the members, what the member means by healthcare worker. How does the member define healthcare worker?
The member for Union Station.
I thank the minister for requesting that clarity. I would actually, I think I gave a few examples. So nurses, doctors, healthcare aides. And I would open that up and I would say that, healthcare workers, we know, and the minister, I know would likely agree with this, that healthcare workers, the responsibility is to make our healthcare system function well. falls beyond just that of nurses and doctors and healthcare aides. So I would actually ask if the minister could provide the information in terms of who is vaccinated amongst healthcare workers for as many healthcare staff as possible. So I know that the department actually does outline who falls into the category of healthcare workers. And so I would ask that whoever it is that they are identifying as such and who they are tracking in terms of who is vaccinated, they could provide those details. That would be great. And again, if the minister has those readily available right now and can provide that, that would be wonderful.
The Honorable Minister of Health and Seniors Care.
I thank the honorable member for Union Station for clarifying that information is not readily available. I will take it under advisement and provide that information at another date.
The member for Union Station.
Thank you, Minister, for agreeing to that undertaking. I would ask, can the minister provide some clarity around which healthcare workers are reporting or being asked to report, or however that information is being tracked, but can the minister provide clarity around which healthcare workers are providing information in regards to vaccination status, whether that's they've had first and or second doses? That would be wonderful. Thank you.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair. And I thank the honorable member for Union Station for that question again. That information is not readily available at my fingertips. I will take that under advisement and come back to them with a response.
The member for Union Station.
Can the minister verify that healthcare workers, that in fact the department is tracking how many healthcare workers are vaccinated? And can she provide clarity as to when that tracking started?
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and I thank the honorable member for Union Station for the question. This information is currently being tracked, and it's being tracked by each employer, and it is specifically for direct care workers. This activity began in September. I do not have the exact date, because each employer may have started 1 or 2 days or possibly a week after the other. And when the public health order was signed and released, employers began tracking this information, noting that the deadline date is October 18th for direct care workers to identify whether they have been fully vaccinated. This is being done on a voluntary response basis. Some managers are talking directly with their staff that report to them in a manual process. Some are using a IT tool, a computerized tool, but that information is being captured by the employer and not in the department.
The member for Union Station.
I thank the minister for that response. And so can the minister, although she's kind of already done so, the minister has articulated to some degree the ways in which this information is being gathered. But can the minister explain whether or not the expectations in regards to who is providing that information at each site is consistent? So did the minister provide, did the department provide criteria, I guess is the language I'm looking for, criteria for each workplace to adhere to in order to facilitate consistency, or what specifically was disseminated to these sites in order to accumulate that information? Again, she's kind of indicated that some managers or sites are pursuing that information in ways that they identify make sense, but was there some sort of a template provided, an expectation delivered by the department for these sites? Thank you.
The Honorable Minister of Health and Seniors Care.
I thank the honorable member for Union Station for the question. I can report that there was considerable debate as the member also worked in the health system like myself, and there are so many positions and so many, such a variety of positions. So there was considerable debate around the definition of a direct care worker. But once we arrived at that definition and classified the healthcare workers accordingly, shared health, Lynette Saragusa, who's the co-incident commander and chief nursing officer for shared health, took the lead in terms of developing the communications using the public health order around the timing of the vaccinations. So the criteria was that direct healthcare workers needed to have their first vaccination by September 7th to meet the October 18th deadline. We also did this to ensure it coincided with the start of school, which was September 7th, so that teachers and direct educational personnel were also had at least one vaccination at the start of school. So moving forward, if you wait the 28 days after the first vaccination, takes us to October 18th, which is the deadline date. So that's the criteria that was being used, is ensuring that first dose is done on the 7th, second dose, and they're fully vaccinated by the 18th. So that's the criteria. The template may have, when we talk about template, I think we're really talking about communication materials. So Lynette has taken the lead in terms of developing communication materials that would speak to the various categories of healthcare workers. And that information has been developed and communicated across the entire health system. Thank you.
The member for Union Station.
I thank the minister for that response. That certainly helped shed a bit of light on that process. I'm wondering if the minister can share what it was exactly that Lynette Saragusa came up with in terms of that criteria that was disseminated to healthcare facilities.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair. And I'm looking at the Shared Health website. This is where the information was disseminated, and it's quite a lengthy document. We'd be happy to photocopy the entire document and make it available, but I'll just maybe go through some excerpts from the document where it starts with background stating that a public health order anticipated to be in effect October 2021 will require direct care healthcare workers across Manitoba's health system to be regularly tested for COVID-19 and to provide proof of a negative test in advance of a shift, or to be fully vaccinated for COVID-19 and to provide proof of vaccination to their manager designate. And it says the order will take effect by the end of October 2021, with all direct care workers required to comply with regular testing or proof of vaccination as of October 18th, 2021. And then it goes on to define direct care worker, and it states who would not be included. So for example, common areas such as elevators, cafeterias, hallways, public washrooms, but would include wards, private patient resident rooms, transport facilities and vehicles. It talks about testing, just to allay some of the fears around, a lot of people talk about the tearing up when they do the nasal swab. So there's a lot of information talking about the principles of testing, the two types of tests, the testing process, with an attachment to a Zoom Teams PowerPoint presentation. And then the information on self-recording each time a direct healthcare worker completes a test. And testing frequency is explained, videos on how to do the test. Education for managers is there. Quite a lengthy document, even infection prevention and control considerations, physical space recommendations, and occupational and environmental safety and health, rapid testing, presumptive positive fact sheet. So quite a bit of information. Again, we'd be happy to print all of this information and make it available to them, and answer any additional questions.
The member for Union Station.
Thank you, Mr. Chair. I thank the minister for that response. I look forward to receiving that undertaking. I think that will be very insightful. I'd like to ask now a question that is specific to some comments made last week by Dr. Alex Chochinov, and I'm sure the minister is well aware of the doctor's comments that were made in the media last week. They were significant. There were significant comments made. Dr. Alex Chochinov, I apologize for mispronouncing that. I know how important it is to pronounce names correctly, so I apologize. Stated that there was a profound failure of leadership. That's a direct quote in addressing ER wait times. And while we all know that Dr. Chochinov was a proponent of consolidation, one of the things that he made very clear, explicitly clear, in fact, is that the Conservative government needed to tread slow, and to make sure that they were building capacity in our healthcare system, in facilities, before closing facilities. We all know that that is not what happened. We all know that, unfortunately, the Conservative government pushed forward, pushed ahead, did not make sure there was adequate capacity in our healthcare system, in facilities. And as a result, a direct result of that, we have seen chaos in our healthcare system, and we've seen an incredible amount of burden on our healthcare staff in our emergency rooms. So I'm wondering, given how significant the comments that were made last week were, how clear Dr. Chochinov is in regards to saying that it is a profound failure of leadership, that this government failed to address the areas that he indicated need to be, and many folks did ahead of time. Can the minister share what her perspective is, what her thoughts are on the comments made last week?
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and I thank the honorable member for Union Station for the question. It gives me an opportunity to just extend my personal thanks to Dr. Chachanov for his report, sitting in this chair as the new Minister of Health and Seniors Care. I haven't had the opportunity to extend my appreciation to him. Dr. someone I have had the privilege of knowing when I worked and working with in the WRHA, highly respected and regarded. So since his wait times task force report in 2017, I just want to, in terms of the member's question about my thoughts, is that I know that shortly after receiving Dr. Chachanov's report, we added 1,000 additional hip and knee procedures, as well as 2,000 additional cataract procedures to help reduce wait times. And that's coming right out of Dr. Chachanov's report. And then in 2019, our government committed $90 million to a redeveloped emergency department at St. Boniface Hospital. And if you've driven by or been in the St. Boniface area, construction is underway. But before that commitment, Dr. Chachanov was heading up an emergency. He was lead for an emergency physician's table, and his report had asked for some capital investments to be made into St. Boniface Hospital emerge, and realizing that that would assist with patient flow and wait times. And that work had already started before our government made the $90 million commitment. In 2020 as well, $10 million fund was established for priority procedures. And sadly, just when we were starting to see some of the, for lack of a better phrase, fruits of our labor, or the payoff of those investments, the day after we committed the $10 million, the World Health Organization declared COVID-19 a global pandemic. But even while that was happening, Mr. Chair, in budget 2021, our government has committed $812 million for Manitoba's clinical and preventative services plan for rural and northern Manitoba. So this is going to impact the system greatly, not just on a clinical level, but ambulance services in rural and northern Manitoba. We'll be able to address some of the EMS shortages and wait times there. We continue to contract with service providers like Manitoba Cancer Care, Western Surgery, to safely provide additional surgical services that would not impact COVID care and our wait times. So if I think back to, I've always had a passion for health, even when I wasn't working in healthcare, and I monitored very closely the decisions that were being made by governments. And I recall that in 2015, emergency department wait times in Manitoba were the worst in Canada. And that was without the added pressures of a global pandemic. So the data that we were starting to see just before the pandemic was declared was showing some early results of the transformation that was happening in the system. This was before the pandemic. And, you know, some of our median wait times in the WRHA were starting to show a reduction. So staffing shortages have really impacted wait times, the pandemic being the biggest contributor of our wait times. So Dr. Chachanov's report was submitted to government at a different time and in a different space. And while we appreciate and recognize the good work in that report, we are dealing with a much different situation with our pandemic. We will certainly be getting back to all the recommendations that we've received in reports, not just
The minister's time has expired. The member for Union Station.
I thank the minister for that response. I think it's really important for all of us to be very clear about the fact that these challenges in the emergency room maybe were exacerbated by the pandemic, but certainly they predate the pandemic in terms of the fact that healthcare workers' morale being very low was reported before the pandemic. Shortages in emergency room in terms of staffing were occurring before the pandemic and were a direct result of this government rushing ahead to cut and close aspects of our healthcare system against the advice of the very people the minister is saying now that they'll listen to in terms of implementing their advice and their expertise. And the minister knows, and she wasn't the Minister of Health at the time, and I recognize that, but the minister, being someone who does follow healthcare, is well aware of the fact that healthcare workers took the extreme step before the pandemic of going to the media and making their concerns heard, that they were in crisis, in chaos in our emergency rooms, that in fact they were without the resources and the needed investment by this government in order to make sure that the care they were providing was sustainable. And unfortunately, what we've seen during this pandemic is the continued failure of the government to adequately invest, to listen to frontline healthcare workers and providers, and to take the steps that they are identifying as necessary in order to mitigate the harms that are happening right now. I think it's important for the minister to, reflect on more recent history in terms of these record high wait times we're seeing in emergency rooms in July and August, including the fact that 1 out of every 4 patients that arrived to the emergency room just last month or the month prior, alone, left the emergency room without being seen. We know that under this government, folks are presenting to emergency rooms sicker and more frequently than they were beforehand. So I think it's really important for the minister to not deflect, but instead to reflect very, very earnestly on the comments made in the media by Dr. Chochinov, and to take them very seriously. Or else, a failure to do that would indicate that there is an ongoing failure to adequately plan and to respond appropriately to address these concerns. And certainly none of us want to see that ongoing failure perpetuated. We want to see this Minister of Health rise up to this occasion where her predecessors chose not to do so for the betterment of healthcare for all Manitobans. Now, I'm wondering if the minister can talk a bit about the fact that, on the wait times task force, which Dr. Chochinov was co-chair of, he did indicate that remaining facilities needed to be very significantly upgraded before closing facilities. That includes addressing staffing. The minister talks about, work that's been done, money that's been invested, but the minister fails to identify the fact that we're in a staffing crisis in our healthcare system in emergency rooms, and that has never been meaningfully addressed under this government. So I'm wondering if the minister, from her perspective, if she can share why that very important advice by the wait times task force was ignored by this government, and what she intends to do in her capacity as Minister for Health to right those wrongs and to rectify those mistakes.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and I thank the honorable member for Union Station for the question. And I agree with the member that there have been challenges over time in the health system, and some of the challenges they refer to have been longstanding issues back to the time when the NDP were in power. And after receiving Dr. Chachanov's report, the wait times reduction task force report, which was released in 2017, we did as a government recognize that it was a driving factor that led to the launch of the development and subsequent release in 2019 of Manitoba's Clinical and Preventative Services Plan. I want to assure the member that quite detailed and lengthy discussions were held with a lot of frontline healthcare providers. They were consulted, and I've heard since taking my seat as Minister of Health that it's the first time that healthcare providers felt so heavily engaged in the development of a plan. Again, Dr. Chachanov was part of a process along with rural medical colleagues that contributed knowledge and expertise. He led an interprofessional provincial team to develop an integrated plan aimed to improve overall healthcare in Manitoba, including in emergency departments. And some key performance indicators were developed, and he is some of his work has contributed in significant ways to the Clinical and Preventative Services Plan. Some of the things that are being done, although we are in the midst of a pandemic, to make it easier for individuals to access care, this is just some of the things that have been put in place, such as online assessments that help a patient determine whether they should be tested for COVID, virtual consultations with physicians, allowing patients to access care without leaving their home, the development of dedicated stroke protocols across the province, and the establishment of telestroke, which allows clinicians in remote and rural areas to more quickly consult with neurologists to diagnose and treat stroke patients. And in 2020, about 350 patients were seen and assessed in this way across the province. I look forward to the 2021 results, which should be stronger than the 2020. We strengthened clinical supports for ERS, including standardized clinical protocols, enhanced medical control to provide additional clinical support to paramedics in the field, and a more coordinated response for interfacility transfers. And we established various outpatient settings to support the COVID response, including testing sites, isolation centers, and the virtual COVID outpatient program, which allows medically appropriate patients recovering from COVID to be cared for virtually from home instead of in a medicine unit. And I look back to 2018 as well, when our government invested $5 million into emergency department expansion project, and it was expected to consist of a number of phases, beginning with the demolition of the ambulatory care space beside the St. Boniface Hospital, and which led to the work that I mentioned that was done before the 90 million. Then the Grace Emergency Department development, my son actually worked on that project. So these are some of the things that we have put in place since receiving the report, and we'll continue to move forward under our Clinical Preventative Services Plan.
The member for Union Station.
Thank you, Mr. Chair. I thank the minister for that response. Again, I would say it's interesting. It's one thing to tout expansions in emergency rooms and that work done. It's another thing to be reflective and honest about a failure to adequately prepare those very spaces to function adequately once they're up and running. And unfortunately, the minister just mentioned the Grace Hospital. I mean, we've all heard and seen very clearly as those staff have courageously brought forward their experiences and concerns, just how much they're struggling over in that emergency department in acute care and critical care at Grace Hospital. Incredibly under-resourced, incredibly understaffed. The crisis is across the system in emergency rooms, but certainly the folks over at the Grace have been very clear about the fact that they're really unable to keep their heads above water in that department. And I would sincerely encourage the minister to engage with those frontline providers who are struggling, who have made very clear what needs to be done in order to address those concerns, and who, quite frankly, and I've said this before, previous ministers have not listened to, and therefore the adequate decisions that needed to be made were not. And so the minister has an opportunity now to rectify those wrongs, to address those failures in our healthcare system, listen to those healthcare providers, and do better for Manitobans in our healthcare system who are accessing oftentimes healthcare in their worst and scariest moments. I'd like to move on to something that our leader, the member for Fort Rouge, raised today in question period that is deeply concerning and very troubling, given the fact that this announcement has been made several times in regards to the surgical backlog. We know other provinces have addressed their backlogs. We know that British Columbia is an example of a province that aggressively tackled their surgical backlog and addressed it hugely in that jurisdiction. In many ways, Manitoba could do the same thing here, yet that hasn't happened. But we did hear on multiple occasions the announcement of $50 million being set aside in the budget to address the surgical backlog. And yet we know now that Manitoba has not only failed, this government has failed to address the surgical backlog, but their very own announcement of $50 million to do so has barely been tapped into at all. That a meager $2.46 million of that $50 million has been spent. Can the minister explain to us why that is?
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair. And our government, I want to assure the honorable member for Union Station that our government takes this very, very seriously. After completing preparations for our fourth wave activities, there is no higher priority for me as the Minister of Health and Seniors Care than addressing the surgical and diagnostic backlog. And that work has begun. I was pleased to have a very good discussion with Doctors Manitoba a couple of weeks ago, talking about the work that the committee will be tasked to complete. And I also want to state that all jurisdictions, I have family members in Ontario, family members in Alberta, and in Vancouver that are sharing with me the surgical slowdowns in those jurisdictions as a result of COVID. So the problem is not unique to Manitoba, but we certainly don't want to minimize the impact that it's having on individuals here in our province. And the member is correct that our government committed $50 million to address the surgical and diagnostic backlog in budget 2021. And we do hope that their government will join us in unanimously supporting our budget when it's voted on. And so we have contracted with organizations and partners to perform over 11,000 additional procedures to begin to address the backlog caused by COVID-19. And it includes that Pan Am hand procedures, foot procedures, Western surgery, cataracts, pediatric dental and plastics, Cancer Care Manitoba, urology, Vision Group, cataracts, Maples, general surgery, ENT procedures. I also was pleased to hear that Pan Am, Misericordia, and Victoria General Hospital all went back to their full slates at the end of Wave 3. Concordia went back to full slates at the end of September, and Grace returned to full slates as of today. So I do recognize that there are hospitals that have not returned to their full slates, and we're certainly supportive of assisting those facilities to get back to full slate. And that's why as of October 4th, we've opened our 5th request for supply arrangement for surgical services to address the backlog of procedures due to COVID-19. And we're accepting proposals to address the backlog. And the last two proposals, 2021, $4.2 million, 21-22, $8.1 million that allowed for 8,300 procedures to be contracted. So now we've gone forward with requests for proposals in endoscopy, cataracts, pediatric general surgery, dental and ENT, outpatient spine procedures, adult ENT, and general surgery. And we hope to see this backlog reduce significantly, but I'm certainly heartened by the results that I'm seeing with the facilities that have returned to full slates and are servicing Manitobans that are in need of critical surgeries and diagnostics.
The member for Union Station.
Thank you, Mr. Chair. I thank the minister for that response. And with all due respect, I would ask the minister why anyone would think it's appropriate to hope that things return to any semblance of a baseline before the pandemic. Hope is certainly not adequate. It is wholly inadequate in terms of addressing a surgical backlog and diagnostic backlog. As Doctors Manitoba reported was well over 100,000. I guess, my concern here is that the minister is not clearly articulating how it is possible. How can she even think it is conscionable that $50 million that her government has repeatedly gone out and said to Manitobans is the money they're investing to immediately address this backlog, that $2.46 million of that $50 million has been spent. Anybody can look at that and say something is very, very wrong here. And I would also say that returning to a full slate for these facilities, again, is inadequate. We know that we are in a surgical backlog that is astronomical here in Manitoba, that simply returning to a full slate is not going to cut it. It's just not going to address the backlog in any sort of appropriate or adequate manner. And I'm sure the minister is well aware of that. And so I would ask the minister again, how is it possible that not even $3 million of the $50 million that her and her government have announced repeatedly has been spent? How is that even possible? And I would also ask for the minister, in addition to explaining how it's possible, why it is that only that amount of money has been spent out of that $50 million, if she could also update us in regards to how much money, how much out of that $50 million has been spent to today's date. Thank you.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and I thank the honorable member for Union Station for the question. I am informed by Shared Health that the number of surgeries that are delayed is more in line with 30,000 and approximately 30,000. And I do want to remind the member that Manitoba certainly experienced the third wave later than other provinces. So if I recall, I remember in the summer, our surgeries were shut down because of that third wave. And coming out of it, we've taken proactive steps as a government to blunt the fourth wave. The delay of surgeries is definitely a capacity issue, and we are working to increase capacity. I know that members opposite don't like when I talk about nursing shortages and explain that to staff. An ICU bed 24/7 requires 5 EFTs, and it's not one person. And so capacity is an issue. Some individuals have been moved to other areas within the system. And so as we blunt our fourth wave and keep our cases down and get our vaccinations up, we will be able to perform these surgeries, get people the care that they need as quickly as possible. We're also working with sites outside of Winnipeg because we have to remember that there are locations outside of Winnipeg that can perform surgeries as well. So we are working with those locations. And again, I, as the Minister of Health and Seniors Care, take very seriously getting the backlog addressed. Happy to be working with Doctors Manitoba. Again, I had a really good discussion with them a couple of weeks ago about the committee that has been struck and some of the innovative solutions that will be coming forward. So very happy to hear from them how we'll be working together. I'm committed to addressing the backlog. Everyone around the table is, and it's by working together that we reduce these numbers. Again, it's not unique to our province, but we do focus on the needs of our citizens and ensuring that they get the care that they need as quickly as possible.
The member for Union Station.
Thank you, Mr. Chair. I thank the minister for that response. I appreciate that the minister has shared the approximate number of surgeries that are currently delayed. I'm wondering if the minister can also share some specifics around diagnostics. We know, and it was reported today actually, that there was a significant rationing of diagnostic testing in Manitoba that includes tests for superbugs and for certain types of bacterial infections. I'm sure the minister is aware of that. But I'm wondering if the minister can provide some clear information in regards to what specific diagnostic tests were rationed and for how long were those tests rationed? Thank you.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and I thank the honorable member for Union Station for the question. I want to share with them that throughout the pandemic, clinical leaders have looked at ways to increase capacity for surges in COVID-19 testing demands and patients requiring care. So in the same way, surgeries and some specialized services have been delayed, some microbiology testing was identified by clinical leaders as a service that could safely be suspended or delayed on a temporary basis to help increase COVID testing capacity. So the suspension of some microbiology testing, which includes some urine testing, was activated during waves 2 and 3, but is not currently in place. The temporary limitation of several types of simple lab tests represented less than 1% of the testing offered in these labs. And this temporary change was made in consultation with senior healthcare providers who can use other clinical indicators and tools in place of these tests without compromising patient care. So should a healthcare provider determine, for example, one of these tests is necessary for their patient, it was completed upon request. And healthcare providers were advised to contact the appropriate clinical microbiology lab if individual patient cultures or testing was deemed necessary. So microbiologists, including the medical director of laboratory services for Shared Health, who is a microbiologist, was responding to these requests. So again, this was a temporary change made in consultation with senior health care providers who every day across our system use clinical indicators and tools in place of some tests, depending on what they feel is best for their patients. And again, these types of simple lab tests that were done represented less than 1% of the testing offered in labs. So temporary and less than 1%. Thank you, Mr. Chair.
The member for Union Station.
Could the minister, she gave a couple of examples, but could the minister endeavor to provide a clear list of which diagnostic tests were rationed and a clear indication as to how long? Would you be willing to take that as an undertaking, is my question.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and thank the honorable member for Union Station for the question. We will certainly endeavor, I will certainly endeavor to go back to Shared Health and ask about specific circumstances where they attempted to demonstrate lab tests that were not necessary or were being inappropriately ordered, and whether they looked at other types of tests that were appropriate for use and make that information available.
The member for Union Station.
Thank you, Minister. Thank the Minister for that response and for agreeing to undertake that and come back with that information. I'd like to ask specifically about Boundary Trails Hospital. It was announced last month that close to 10 beds had to close due to a shortage of workers there. Can the Minister update as to whether or not those beds are still closed and if in fact there is a plan to reopen? And I'm also wondering if the Minister can share how the region, how that region is dealing with the critical shortage of nurses. Thank you.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and thank you to the honorable member for Union Station for the question. We certainly want to support all our healthcare facilities, not just now, but in the months and years to come. And I understand that Boundary Trails the beds are closed as of right now, and they will be closed until October 13th. And in terms of how they're dealing with shortages, I know that we have our overall provincial strategy in terms of nursing shortage that they will benefit from. But I want to share with the member that in terms of funding for our personal care homes, budget 2021 invests over $653 million in PCHs, and that's more than the NDP government back then ever spent. And 2016-17 PCH funding is 644,129,000, and 21-22 PCH funding 653,873,000. So since we took office, we've built 510 personal care home beds, and I was pleased to be out in for the Boyne Lodge opening ceremony where we were adding more beds there. And the premier recently was making an announcement in his area of Steinbach as well. In June 2020, we announced a historic $280 million investment in safety upgrades to personal care homes. So some of them had leaking roofs and furnaces that were prehistoric and falling apart. And it took our government coming in and cleaning up the mess made by the NDP government and saying to our seniors and our vulnerable population that we are going to take care of the upgrades to the facilities that you reside in. And so in our first 2 years in government, we built almost twice as many PCH beds in Winnipeg as the NDP did from 2010 to 2016. And we continue to invest, we continue to build, we continue to provide innovative housing. When I was out at Boyne Lodge, they referred to the new style of care as small houses. And I was so impressed to see that we're not just moving forward with traditional ways of seniors living together, but new approaches that allow for more interaction between residents and more sharing of meals and more communal living. It was very good to see. And so our government will continue to invest again in 21-22, $653,873,000. And we will be doing more to assist our seniors.
The member for Union Station.
Thank you, Mr. Chair, and I thank the minister for that response. I do find it interesting that oftentimes when members opposite will talk about beds they've created in long-term care or other such things, they'll neglect to mention those efforts that were actually started under the NDP and the projects that were actually initiated and developed by the NDP, but that's an aside for the minister. What I'd actually like some clarification on, if the minister should have this information actually readily available, but if the minister can share what the global funding allocation to the health regions is for this year and last year as well, and if the minister could please break that down by region.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and I'm pleased to Regional Health Authority, $2,188,301,000.
I'm sorry, Minister, we lost your voice for a second. Could you start all over again, please?
The number for the Winnipeg Regional Health Authority.
The Honorable Minister of Health and Seniors Care, if you could start from the beginning, please.
Thank you, Mr. Chair, and I'd like to provide a response to the honorable member for Union Station with regard to the global allocation for RHAs. Can you hear me now? Okay. For the Winnipeg Regional Health Authority, $2,188,301,000. Prairie Mountain Health, $578,933,600. Interlake Eastern Regional Health Authority, $240,677,500. Northern Regional Health Authority, $230,095,800. Southern Health Sante Sud, $441,791,300. That concludes the response.
The member for Union Station.
Thank you, Minister, for that response and for providing that breakdown. Can the Minister provide the global allocation for cancer care for this year and last year? And sorry, just so that I'm clear, the Minister did provide the allocation for each regional health authority, I believe I think she provided it for this year, but could the Minister also provide the information for last year? I just want to I'd asked for this year and for last year per region. So I'm just wondering if the Minister can provide for the year that she has not, and as well as she could provide the global allocation for cancer care for this year and for last year. Thank you very much.
The Honourable Minister of Health and Seniors Care.
Thank you, Mr. Chair. I can respond with the number for cancer care for 21-22, and that number is 211,938,700. We are accessing, the department is accessing the number for 2020-2021, but before that information is provided, I want to make the member aware that the number that I provided for fiscal year 2021-2022 is mental health, wellness, and recovery, being a new department. All of that is pulled out from these numbers. So when the number for 2020-2021 is provided, it will show a different allocation, because at that time the department was one. So the number is going to be different, but we are seeking that information, Mr. Chair.
The member for Union Station.
I thank the minister for that response and for providing that extra a bit of clarity around what we can expect there and why. I'd like to allow for my colleague, the member for Thompson, to ask a question of the minister at this time.
The member for Thompson.
Thank you. And I'd like to thank my colleague from Union Station for providing me an opportunity to ask this very important question. Is the minister aware, me and my colleague from Flin Flon on September 9th sent the minister a letter regarding Northern Patient Transport and our concerns with dialysis. Under the current policy, Northerners are not eligible for Northern Patient Transport when they have to reside in Winnipeg for upwards of a year while waiting for dialysis. We have yet to receive a response from the minister, and we are wondering if the minister could please provide information regarding the status of the letter and if Northerners will be eligible for Northern Patient Transport when they are having to relocate to Winnipeg for upwards of a year while waiting for a dialysis spot.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and I'm pleased to provide a response in regard to the Northern Patient Transport Program. I want to be sure that everyone knows what this program is about. It subsidizes medical transportation costs for eligible Manitoba residents north of the 51st parallel east of Lake Winnipeg and 53rd parallel west of Lake Winnipeg when they have to obtain medical or hospital care not available in their home community. And it was transitioned to the regional health authorities in 1997 as part of the regionalization process. The Northern Patient Transport Program is established under the Emergency Medical Response and Stretcher Transportation Act. And it sets out that the minister may pay financial grants to RHAs charged with the administration of the Northern Patient Transport Program or make direct payments to such persons as the minister may determine. And in 2020, this program assisted nearly 20,000 individuals who needed to travel to access care and paid out $18 million approximately. Now, I do hear from time to time, and I was up in Thompson a couple of weeks ago and travel in the north, hearing from our healthcare professionals on the mental health, wellness and recovery side of things. And I shared with them that our government's investment of $812 million in budget 2021 will allow for the creation of a northern hub that will see a reduction in individuals having to travel for care. My office is in receipt of the letter, and a very detailed response will be provided. But we will continue to support individuals that need to travel away from their home to access care in Winnipeg.
The member for Union Station.
I'd like to ask a question in regards to neurology. I'm sure the minister is aware it's been made very public, especially more recently. My colleague, the member for Wolseley, has also, I know, written letters, as has our leader, the member for Fort Rouge, on this very subject. But we're all aware about the issues and the problems that exist in neurology in Winnipeg. Last year, we know that many staff in neurology actually quit. They left their jobs entirely. And we know that at that time last year, there was a vacancy rate of 36% in neurology, which is incredibly high. And now, unfortunately, we know, and this was published in the news very recently, that Dr. Dimitri Setterless has also resigned, which is very disappointing. It's a big loss for us here in Manitoba. You know, there are estimates that about 6,000 patients would be eligible for surgeries that would help end seizures altogether if the proper program was up and running here in Winnipeg. And we also know that a significant donation of $2 million was made in just a few years ago in 2017 from Domino's Pizza Canada CEO, Michael Schlatter. Now, this specific donation was made towards a special program for children with epilepsy. And it's reasonable. We've asked this question actually via letter to the minister, but we know that other folks who had children waiting for these very important surgeries have also written. Can the minister please explain and provide an update as to what happened to that money? Where is the money that was donated by the CEO in order to establish a special program for children with epilepsy?
The Honorable Minister of Health and Seniors Care. Minister, we cannot hear you. The Honorable Minister of Health and Seniors Care. Thank you.
Thank you, Mr. Chair. And if we could return to a previous question from the Honorable Member for Union Station regarding the global allocation to the RHAs and cancer care for the year 2021. I now have that information available. The Winnipeg Regional Health Authority, $2,152,667,000. Prairie Mountain Health, $555,680,900. Interlake Eastern Regional Health Authority, $231,654,700. Northern Regional Health Authority, $222,095,000. Southern Health Sante Sud, $383,204,300. Cancer Care Manitoba, $186,768,700. And I will respond shortly to the question before us regarding the neurology program.
The member for Union Station.
Sorry, is this minister just looking up the information regarding neurology? Should I move on to another question, or just so that I'm clear?
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair. The information is being looked up, so the member can proceed to another question.
The member for Union Station.
Thank you for providing that clarity. Can the minister please provide the current vacancy rate in neurology right now in Winnipeg? Completely fine if this is taken as an undertaking, as along with that request, what I would ask is that be broken out with as much detail as possible. So what is the vacancy rate in neurology in Winnipeg right now? But if that could be broken out by sites, by number of neurologist positions, number of vacancies and the vacancy rate, if that could be all broken down and included in that response, that'd be wonderful. Again, if the information is available now, fantastic. If it needs to be taken as an undertaking, that's perfectly fine as well, and would be appreciated.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair. And I do have a part of that answer available. I will be taking the vacancy rate and the detailed information regarding vacancies by site, et cetera, requested by the Honorable Member for Union Station under advisement, and we'll make that available at a later date. I do have the information with regard to the neurology program, and I want to start by saying our government remains committed to improving healthcare for all Manitobans, which includes long-term efforts to strengthen neurology services and care for patients with epilepsy. This includes a long-term plan to develop adult surgical program. The neurology program, just to give you a flavor of what it encompasses, the components of a comprehensive program might be expected to include pediatric and adult epilepsy monitoring space, equipment and staffing, support for epilepsy neurologists and neurosurgeons, support for epilepsy surgery equipment and operating room resources, robotized stereotactic assistant equipment for surgical cases, and epilepsy-related education and research. Shared Health has been working with my department to take an incremental approach to developing such a program. So as the member correctly stated, our government on May 10th, 2021 announced $4 million in capital funding to establish an adult epilepsy monitoring unit. This funding was for monitoring equipment, monitoring software, and construction of a 4-bed adult epilepsy monitoring unit. So part of the construction, there's always stages to a project, and planning, as most project managers will tell you, the longest phase of a project is the planning. You plan well, you can execute well. And planning has been underway. The unit will be located at Health Sciences Center, and I'm told it will take 4 to 6 months for the unit to be fully constructed and up and running. So imminently, the actual, I guess, you'll hear hammers and construction occurring to actually begin to create the space. But part of constructing, part of any project is planning, executing, monitoring, and controlling for any risks. And then, of course, closing the project. So 4 to 6 months for that to occur.
The member for Union Station.
I thank the minister for agreeing to undertake to provide the information requested in my question. I'd like to, before we move on to my colleague, the member for Point Douglas, I'd like to ask one question very quickly about primary care here in Manitoba. Because it is so important that folks have access to a primary care physician, primary care provider, in order to have increase, positive health outcomes. We know that the PC government has had a difficult time maintaining timely access to primary care, whether that be a physician or a nurse practitioner. The minister currently has a website, Family Doctor Finder, that shows how many people are searching for care and how many get it within 30 days. And before the Conservative government took power, things were pretty consistent. 80 to 90% of Manitobans were getting access to a primary care provider within 30 days. And then the closures started, right? So we saw quick care clinics close and shuttered. We saw primary care facilities start to close. We saw, some things like labs located in primary care providers' facilities also close, which disrupts people's ability to access primary care and early intervention. This disruption is ultimately, it's been pronounced, which is what I'm getting at. In the last quarter, only 32.1% of patients actually got timely access to a care provider within that 30-day time period. So I'm wondering if the minister can provide for us what her plan is to address timely access to primary care. What steps is the minister taking to do so?
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair. And I thank the honorable member for Union Station for the question. I'm not sure if the member is aware that the training program for primary care physicians tries to use a distributed education model where you're distributing individuals coming out of the program across the province. I want to be sure as well that we all understand what primary care refers to, and it's that early contact with the healthcare system when patients and their families receive a diagnosis, treatment, or help with a new health problem or chronic condition. Services can also include speaking with a healthcare provider about staying healthy and preventing illness. So ongoing physician recruitment and retention efforts is a key priority of clinical services planning to be undertaken by Shared Health. So where we are hearing of individuals that are seeking physicians, Shared Health is very much involved in an aggressive and innovative recruitment process. And the work of Shared Health will support consistent and reliable healthcare services, effective health, human resource planning, capital equipment investment, construction planning, and other initiatives that should be coordinated, that will be coordinated province-wide. Now, I myself was pleased to be in Interlake Eastern Regional Health Authority for the announcement of our graduates that would be going into the various rural communities. At that time, it was, if I'm not mistaken, I think there were 9 family physicians that would be practicing in the Interlake Eastern Regional Health Authority. And that was in addition to the 4 family medicine residents that were completing their training in that region. You know, the focus is to, as quickly as possible, have residencies, individuals completing their residency, which is the last stage in training for doctors following graduation from medical school, to be encouraged to work in our rural communities, to be encouraged to work in primary care. I know some of them want to go on to be specialists, and many of them are friends of mine, but I always try every opportunity to convince and to encourage those individuals to work in primary care. It's a very fulfilling practice to be in. So when individuals are seeking physicians, they have a pool of physicians to draw from. So we will continue our recruitment and retention efforts to ensure that the Doctor Finder program is able to meet the needs of Manitobans. And I know that I know that the member is aware of this as well, that there are hotspots across our province. There are some areas that experience more difficulty than let's say, for example, Winnipeg. And where those hotspots are occurring, we're working very closely with the Regional Health Authority. Shared Health is, and we will continue to support those efforts.
The member for Union Station.
Thank the minister for that response. And before my colleague actually from Point Douglas will be asking questions moving forward, but I just wanted clarity from the minister. She had said earlier in regards to the Domino's Pizza CEO donation of $2 million that they were working on that. Is the minister providing that response today, or is that an undertaking? I just need clarification.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and I appreciate the honorable member for Union Station clarifying the earlier question. I just want to be sure that we're separating adult epilepsy from children's epilepsy. So in May 2017, Michael Schlater, who's the CEO of Domino's Pizza Canada, donated $2 million, and that was to the Children's Hospital Pediatric Epilepsy Program. So that has been done, and that transfer has been completed.
The member for Union Station.
We can proceed with closing out health.
No further questions on health? Hearing no further questions, we will now proceed to consideration of the resolutions. Oh. The honorable member for River Heights on a question?
Yes. My question to the Minister of Health is, I understand that in order to be seen in a rapid access to addictions medicine clinic, a person must not have had any drugs or alcohol for the previous 24 hours. On one occasion, a person was told 48 hours, not 24. But I understand most often people have been told 24 hours. Now, normally, for rapid access to addictions, medicine would mean being seen immediately, rather than a person having to go through withdrawal on their own for 24 hours first. I wonder if the minister can explain the policy of the RAM clinics with regard to addictions medicine treatment.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and I thank the honorable member for River Heights for the question. I would like to defer that question to the estimates process for the Ministry of Mental Health, Wellness and Recovery. That is where RAM clinics are funded and fall under that particular ministry and not Health and Seniors Care.
The member for River Heights.
Yeah, my second question has to do with in January of 2020, a report was released on the extent of lead contamination in various parts of Winnipeg. This was a report produced by Intrinsic. It was released by the Minister of Health, I believe, and maybe also the Minister of responsible for conservation. Now, the report projected that up to half the children in Point Douglas would be have very high levels of lead and lead levels that would be toxic. Now, I have called previously on the government to test lead levels of children between the ages of 1 and 3, as is done in many other jurisdictions and has been done in parts of the United States for decades. The minister, I suspect, is quite engaged in this concern about lead toxicity and prevention, in part because the minister should be aware of these problems as they've been known for many years.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair. I think we were cut off because I didn't hear a question.
Could the member for River Heights please repeat the question for the minister?
I would ask what the minister is doing in terms of preventive health to decrease the problems of lead toxicity in Manitoba, but particularly in Point Douglas area.
The Honorable Minister of Health and Seniors Care.
Thank you, Mr. Chair, and I'm pleased to respond to the question posed by the honorable member for River Heights. An independent review on lead in soil in Winnipeg neighborhoods reconfirms that there is a low health risk for Manitobans when it comes to lead in soil. Manitoba Health Seniors and Active Living, now Manitoba Health and Seniors Care, and Manitoba Conservation and Climate commissioned a third-party review to determine if there are any potential risks to human health and how best to identify and manage areas with elevated lead concentrations in soil. The report was presented to government in December 2019, and the province has moved quickly to review its findings and prioritize the recommendations. As recommended, the province will work towards making blood lead levels in excess of established guidelines reportable under the Public Health Act. This move will assist the province to track and better understand where lead exposure may continue to pose a problem. This new information will help focus future public health and environmental efforts where they are needed and will have the greatest impact. The Ministry of Health and Seniors Care and Manitoba Conservation and Climate will also move forward with the recommendation to develop a communications and outreach plan that delivers a single, clear, and effective message to the public and key stakeholders about how to mitigate potential risks. This could include a public webpage or social media platform with regular updates for information sharing and training for parents and caregivers of young children, as well as childcare centers, community centers, and preschools. The Ministry of Health and Seniors Care and Manitoba Conservation and Climate will continue to work with Manitoba Education and School Divisions to develop a plan to address recommendations for schools in the Weston area. Given the primary source of lead emissions in Winnipeg are no longer present, the health risk of lead for Manitobans is low. And I also want to state that the report stressed that soil remediation was not recommended as a course of action.
The member for Union Station.
I'd like to close health, please, if we can move on to resolutions.
Hearing no further questions, we will now proceed to consideration of the resolutions. At this point, we will allow virtual members to unmute their mics so they can respond to the question. I will now call Resolution 21.2. Resolved that there be granted to Her Majesty a sum not exceeding $20,250,000 $258,000 for health and seniors care, policy and accountability for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 21.3, resolved that there be granted to Her Majesty a sum not exceeding $13,546,000 for health and seniors care insurance for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 21.4, resolved that there be granted to Her Majesty a sum not exceeding $28,356,000 for health and seniors care, population health for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 21.5, resolved that there be granted to Her Majesty a sum not exceeding $108,511,000 for health and seniors care transition for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 21.6, resolved that there be granted to Her Majesty a sum not exceeding $3,807,668,000 for health and seniors care funding for health authorities for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 21.7, resolved that there be granted to Her Majesty a sum not exceeding $174,666,000 for health and seniors care provincial health services for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 21.8, resolved that there be granted to Her Majesty a sum not exceeding $1,371,058,000 for health and seniors care medical for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 21.9, resolved that there be granted to Her Majesty a sum not exceeding $284,711,000 for health and seniors care, pharmacare for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 21.10, resolved that there be granted to Her Majesty a sum not exceeding $213,587,000 for health and seniors care, capital funding for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 21.11, resolved that there be granted to Her Majesty a sum not exceeding $1,305,000 for health and seniors care capital assets for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 21.12, resolved that there be granted to Her Majesty a sum not exceeding $292,458,000 for health and seniors care, other reporting entities, capital investment for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. The last item to be considered for these estimates is item 1, bracket A, the minister's salary contained in Resolution 21.1. The floor is now open for questions. No questions? Be it resolved that there be granted to Her Majesty a sum not exceeding $12,142,000 for health and seniors care, resources, and performance for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. This completes the estimates for the Department of Health and Seniors Care. The next set of estimates to be considered by this section of the Committee of Supply are for the Department of Mental Health, Wellness, and Recovery. Shall we briefly recess to allow the minister and critics the opportunity to prepare for the commencement of the next department?
Agreed.
Agreed.
How long would the minister need to prepare?
10 minutes.
The Honorable Minister of Health and Seniors Care has suggested 10 minutes. Is that agreed?
Agreed.
The member for Concordia has a question.
Thank you very much, Mr. Chair. I do appreciate that the minister's officials need a little bit of time. I do see the minister and the critic are here and ready to go. Can we suggest 5 minutes?
There has been a suggestion from the floor for 5 minutes. Would the minister be able to have that request, or does she need 10 minutes?
10 minutes.
There's a request for a recess of 10 minutes. Is that agreed upon?
No,
Agreed.
no,
Agreed.
No.
no.
I hear a no. The member for Point Douglas?
Which, Mr. Chair, I agree with the member from Concordia. 5 minutes is more than ample time. We're nearing the end of the day. I do have a lot of questions that I'd like to get through, and I haven't been able to ask the minister since she's become the Minister of Mental Health, Recovery, and Wellness.
Are there any more suggestions? Like, we need to, I guess, get this resolved before we can get started.
How about 7 minutes?
Minister Gordon?
Thank you, Mr. Chair. 7 minutes?
7 minutes, is that agreed to?
That's fine. Let's Hurry up.
The
7
committee
Agreed.
shall recess for 7 minutes. Would the Committee of Supply please come to order? The 7 minutes for our recess is over. This section of Committee of Supply will now consider the estimates of the Department of Mental Health, Wellness, and Recovery. Does the Honorable Minister have an opening statement?
Thank you, Mr. Chair. Yes,
The
I
Honorable
do.
Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair. Both the Department of Health and Seniors Care and the new Department of Mental Health, Wellness, and Recovery will work in collaboration to advance their mandates through an appropriate balance of prevention and care. The Departments of Families, Justice, and Education have started to identify the resources and programming that are mental health, wellness, and recovery focused. It is expected that operational transfers will occur during the year and be reflected in budget 2022-2023. This year's budget includes investments in the following. 341.9 million core budget includes funding to support the operations of Selkirk Mental Health Center, 49 million. The Addictions Foundation of Manitoba, 24 million, and the other organizations that provide mental health and addiction services in Manitoba, such as the 5 regional health authorities, Shared Health, and many grant-funded agencies. A one-time increase of 5.0 million for a transition budget line that will allow the department to conduct stakeholder consultations to determine the most significant need for resources so that we are able to continue the work across government to invest in outcomes-oriented mental health and wellness services. Funding of 2.1 million for mental health services for the following service delivery organizations: Winnipeg Regional Health Authority, Prairie Mountain Regional Health Authority, Shared Health, and Northern Regional Health Authority. Notable within this 2.1 million is 1.855 million for the Winnipeg Regional Health Authority to address budget pressures in mental health housing with supports. It is noteworthy that mental health patients are often very difficult to discharge from hospital and often become a contributing challenge to hospital flow and emergency department waits. This funding will develop housing options for mental health patients in order to have a good discharge plan for the patient. Medical remuneration funding of 1.1 million for the Safe Emergency Rooms Initiative, which was part of the Safer Streets, Safer Lives 2019 election commitment. This funding will be used to create the specific medical services to support mental health patients or those with psychosis or other needs presented to emergency departments to help ensure safe environment for all. This helps ensure that staff, other patients, and the patient themselves do not pose a safety threat in the busy ED at Health Sciences Center. Funding for price and volume increases of 1.0 million for psychiatry services, salaries and benefits for new staff, and other miscellaneous operating increases. The physician services budget for psychiatry will continue to allow virtual terrace. A COVID learning is that we continue to see the benefits from the growing use of virtual terrace in psychiatry. The use of virtual terrace has been very welcomed by the medical community and by patients who may be fearful to access psychiatry services in person. My department will work with Manitoba Health and Seniors Care to establish a mental health and addiction program within Shared Health, which was a key Virgo recommendation. And this will be part of the health system transformation. In addition to the items mentioned, we continue to budget for allocation of additional funds from the Central Internal Service Adjustment related to the Canada-Manitoba bilateral agreement on mental health and addictions and home and community care. As we enter into the last year of the first five-year phase of the bilateral agreement, we have continued to budget for significant investments in these areas, including but not limited to some of the following priorities: Thrival kits, integrated youth services, access to mental health emergency assessment and treatment services, school-based mental health supports for youth, Indigenous-led health services, withdrawal management services, sobriety treatment and recovery team, RAM clinic expansions, eating disorder supports, acute medical sobering unit, community 24/7 drop-in, and pregnancy and infant loss. The departments involved are anticipating a combined cost of approximately $23.7 million, which aligns to the values prescribed under the current health bilateral agreement for the 2021-22 year. These funds are currently being housed in appropriation 26.2C. Thank you very much for the opportunity to say a few words on this year's estimates. I would also like to acknowledge my colleagues in families, education, justice, and health and seniors care for their partnership and support in this important work. I would now be happy to answer any questions you may have, and I also want to introduce at the table with me today, Kimberly Kaufman, Deputy Minister, Mental Health, Wellness and Recovery, Karen Hurd, Deputy Minister, Manitoba Health and Seniors Care, Sandra Hinault, Acting Assistant Deputy Minister and CFO, Manitoba Health and Seniors Care and Mental Health, Wellness and Recovery. Thank you, Mr. Chair.
We thank the minister for those comments. Does the critic from the official opposition have an opening statement? The member for Point Douglas.
Thank you, Mr. Chair. I don't have an opening statement. I'd like to get straight to the questions. Thank you.
We thank the member. Under Manitoba practice, debate on the minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 24.1A contained in Resolution 24.1. Does the committee wish to proceed through the estimates of this department chronologically or have a global discussion? The member for Concordia?
Global matter.
It has been suggested global. Is that agreed upon? Agreed and so ordered. Thank you. It is agreed then that questioning for this department will proceed in a global manner with all resolutions to be passed once questioning has concluded. The floor is now open for questions. The member for Point Douglas.
Thank you, Deputy Chair. Manitoba has an agreement with Canada for mental health and addiction support. It's 100% federal dollars. Can the minister tell us how much was allocated to the province in these two areas, so mental health, addictions, for the fiscal year 2020 and 2021? How much was spent and how much has a province requested to carry forward, so unspent?
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and I thank the honorable member for Point Douglas for the question. I do want to preface my answer by saying that mental health and addictions is, they're integrated. So we don't generally in our financials divide out mental health and addictions. They're integrated programs. There, as the member I'm sure is aware, there are times that an individual who is suffering from an addictions has a co-occurring condition related to mental health. So it's very difficult financially to break that out. We don't generally do that, but I can provide the numbers for 2021. The allocation was 22 million and the amount spent was 22 million with no dollars unspent. For 21-22, the allocation is 23.7 million. We do not have, because the year is not completed, the fully spent dollar amount or whether there would be any unspent monies.
The member for Point Douglas.
Miigwech, can the minister tell us how much has been spent thus far from the 23.7 million?
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair. And again, I thank the honorable member for Point Douglas for the question. That information is not readily available. We will take that under advisement since the fiscal year is not concluded. It does require calculation of many different program sources. So that has to be taken under advisement and brought back to the member. What we are projecting is that the full amount will be allocated.
The member for Point Douglas.
Miigwech, Deputy Speaker, and I thank the minister for undertaking that. I look forward to getting those numbers, and you know, it's nice to hear that the province is going to spend all of the federal dollars. Hopefully some provincial dollars will be thrown in there as well, because we know with COVID that there's been an increase in mental health and addictions. So I'd ask the minister, how many mental health workers are there currently through the Winnipeg Regional Health Authority?
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and I thank the honorable member for Point Douglas for that question. Again, just to be certain, it's the number of mental health workers in the Winnipeg Regional Health Authority. I will take that question under advisement. That information is not readily available, and bring the response back to the member.
The member for Point Douglas.
Miigwech, could the minister tell us how many mental health workers there were last fiscal year?
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and again, for the honorable member for Point Douglas. I will have to take that under advisement and bring that number back to you. I'm sure you can appreciate that the ministry was created in January of this year. So it requires teasing out from the previous Ministry of Health, Seniors and Active Living, some of those numbers. So we will, I will take that under advisement and bring that response back.
The member for Point Douglas.
Which, Mr. Chair, I appreciate the minister's willingness to take those under advisement and get us those numbers. I want to switch over to overdoses and ask the minister if she has any updates on how many people have overdosed this year, lost their life to an overdose, and if they know what the drug was that they overdosed on.
Order, please. The hour being 6 p.m., committee rise.